Hey, I'm Stacy, and this is my 5-minute lecture on tuberculosis. Tuberculosis, or TB, is caused by infection of Mycobacterium tuberculosis, Mycobacterium bovis, or Mycobacterium africanum. It is acquired through inhalation of airborne bacilli from an infected person. It affects 10.4 million people worldwide and is one of the top 10 causes of death worldwide. Typical symptoms are malaise, fever, night sweats, unexplained weight loss, painless lymph node swelling, unexplained cough, and hemoptysis. TB commonly is a pulmonary infection that affects the lungs due to it being airborne, but it can be present in the abdomen, central nervous system as meningitis, or disseminated or miliary TB. The picture here is actually a TB infection in a finger. So risk factors for TB infection would be living in close quarters, such as prisoners, nursing home residents, or persons in the military living in barracks. Also homelessness and low socioeconomic status, a known exposure to a person with an active TB infection, tobacco or recreational drug use, working in healthcare as we come in contact or we have more risk of coming in contact with infected persons. And then, although not everyone who is exposed to TB will develop a TB infection, immunosuppression does increase the risk of infection after exposure. So 3 key questions to diagnose would be, have you been in close contact with someone who has an active TB infection? Also, have you recently traveled to an area with high incidence of TB? These are called high burden areas. And the top 8 in the world are India, China, Indonesia, the Philippines, Pakistan, Nigeria, Bangladesh, and South Africa. So the purpose of these 2 questions would just be to see if you have come in contact or are at higher risk of coming into contact with someone who has tuberculosis. And then you want to know, what are your symptoms? So you're looking for red flag symptoms such as night sweats, unexplained weight loss, a persistent unexplained cough, and hemoptysis. So for your physical exam, 3 important things would be: 1, auscultate the lung sounds for adventitious sounds. You're listening for rales in the upper chest is kind of a hallmark of tuberculosis infection, but also you'll probably hear crackles and maybe extended bronchial breath sounds. You would want to palpate the lymph nodes, and you would expect adenopathy that's typically painless. And you want to percuss for hepatosplenomegaly, as that simultaneous enlargement of the liver and the spleen would lead you to thinking of infection. So physical exam findings may be completely normal, and they will definitely vary depending on what systems are involved in the TB infection. So therefore, you want to get a chest x-ray and a TB skin test to help you diagnose. Treatment is INH, rifampin, and PZA and EMB. So these 4 medications in combination, you see the dosages here. So is it going to be daily for 8 weeks or 5 days a week for 8 weeks? And then the continuation phase is INH and rifampin daily for 18 weeks or 5 days a week for 18 weeks if they're on direct observed therapy. So this means that they're actually coming into the office and having a nurse observe them take their medication. This is recommended for all patients to increase adherence, but it is mandatory for pediatrics, institutionalized patients, non-adherent, and non-daily patients. A full recovery and eradication of the infection is achievable with adherence to the medication regimen. So TB education, you would want to educate your patient on the importance of medication regimen adherence. They're not going to get better and eradicate this infection unless they take their medication as prescribed. We would also let them know that we need to screen and treat all their close contacts, as they may also have developed a TB infection. And then you need to let your patient know that this TB infection requires mandatory reporting to the Department of Public Health. Here are the references. 5-minute clinical consult was great help in this one. Thanks so much for listening.